Okay, we're live on Facebook. Welcome, everyone, and thanks for joining us. I kind of feel like David Letterman on that Netflix series, My Guest No Introduction. I'm sure you've heard of Joanne. If you haven't seen her speak, she has been in the dental industry for quite a while, and I won't go into how long, but as long as I can remember, she's been a coach and consultant and inspiration to everyone. I'm just thrilled to have her here speaking with me. We're going to be talking on a few topics today that are certainly timely and important. And Joanne, say hi, and if you want to introduce yourself.
James, thank you for sure. Thank you for the kind introduction, and thank you especially for being so kind as to not say how long I have actually been in dentistry. So I appreciate that, but it's been a very, very, very long time and a wonderful journey all the way along. You know, when I look back on all the different things that dentistry and dental hygiene have brought into my life, it's been a very full and enjoyable career. So thrilled to be with you today at this interesting time.
Absolutely. And you had mentioned to me you started off your career as a dental assistant and then moved into dental hygiene, practicing dental hygienist, and now through coaching and speaking and consulting and inspiring, quite a career.
Yeah, it's been a great journey, as I said, and you know, a few interesting things that happened along the way. And I just want to share this briefly because this is not about me. I want to talk about your listeners. I want to talk about dentistry today, dental hygiene today, what we're experiencing, all of the good stuff, and some of the challenges that we are facing.
Mm-hmm.
But it was interesting when I kind of look at how my career in the past aligns with what we're going through presently. And one of the things I've always said is that out of adversity comes empowerment. And let me share with you why I do say that.
Please.
A number of years ago, I was working in a dental practice, and conditions of employment changed drastically. And I had young children and in a young relationship, second marriage at the time, and still a second marriage. Let me clarify that. Not Elizabeth Taylor. Two was enough for me.
Right.
But anyway, at a point in my career and my personal life where I was really striving for balance. Long story short, I was dismissed from my position because of non-compliance with the working conditions. I was working every evening. It led to a lot of interesting changes at that point in time. And it was really at an unfortunate time when my mother passed very unexpectedly and my father-in-law passed about 6 weeks later.
Oh, wow.
Or not my father-in-law, I'm sorry, but my stepfather. And it seemed like the whole world came crushing down on me. And the reason I'm sharing this is because there's been some weighty things that have been happening in our profession over the last little while. So what became of that was an opportunity in the 6 weeks that my stepfather survived my mother's passing. He said to me, "What do you want to do with your life?" And I said, "Well, I need a job." That would probably be a good start. He said, "Why a job? What's your dream?" And I said, "My dream? Well, I love what I do, but I don't really have a dream." And he said, "Well, where do you see yourself in your profession?" And I said, "You know, the thing that really irks me is that the public still seems to look at the dental hygiene appointment, cleaning your teeth, as a feel-good elective procedure."
Mm-hmm.
They
Get your hair
don't
done,
seem
get
to
your
get
teeth
it. Exactly. If we were cutting hair right now, we'd have them lined up out the door.
Right.
But anyway, I didn't say that. But the feel-good elective procedure and just the feeling that there was a strong disconnection. And when I started sharing with him about, you know, the oral systemic link and some of the other things that I was so passionate about, he said, now I get it."
Mm-hmm.
He said, "Nobody's ever shared that with me."
Right.
You know, so that was kind of the beginning of going into speaking and educating and really dedicating my life, still working in clinical practice, and I still have an active registration. But that was kind of the beginning of saying, okay, I want to be here for my colleagues to help them have the resources to be able to have this meaningful relationship with their patients.
Right. You know, that's a really great and inspiring way to kind of turn things around in a situation. And it really does tie into what we're talking about today, because you can ask most dental professionals right now, and we see this as a difficult time. It's a time of adversity, it's a time of change, it's a time of adaptation. And so we see that, and there's certainly some who will sort of use that as an opportunity to flourish and to make the most of it, and come out on the other side of it stronger and better. And when you and I were talking about it on the phone, you had mentioned that, and I'm on board with this, feeling that despite this, we can turn this into the best time to be practicing as dental professionals, as hygienists, as dentists, and dental assistants. And maybe, do you want to speak to that a little bit? We had a great conversation earlier about it, but maybe you can let everybody know your feelings about that.
Yes, I sure do. And you know, it would seem kind of pious or not really earnest sincerity to be able to say that, because I'm not walking into clinical practice on Monday morning. However, I do feel that at this point in time, we have patients that are sitting in our chair that are going to be ready for the message like never before.
Mm-hmm.
And this presents for us an opportunity to take everything that we know, all the amazing science that is out there, and actually apply it to listening ears, to ears that will be interested in knowing what's going on. You know, and over the last little while, James, I've been looking at, you know, dental websites and going and checking out a lot of the leaders in our profession too in dentistry. And it's certainly not a criticism, but it's an observation of, this is what we are doing in preparation of your return. This is, you know, we've instituted this in our practice, we're doing this, all of the measures related to infection control. And I applaud that. That's great, because we need our patients to feel safe.
Absolutely.
But have we overlooked something so unbelievably critical? And here's the omission. Why is it important for that patient to sit in our chair?
Right.
Have we really communicated that? You know, and I look and I see the beautiful smile and keeping your gums healthy and all the rest of it. But I haven't seen one website yet, and I haven't looked at, of course, all of them, but I haven't seen a website yet that actually says, we need you to be in the chair because of the old WIFM, what's in it for me?
Right.
You know, connecting with the patient and saying, what is the advantage? And, or I always used to say, you know, when I was doing consulting and practices, so what? So what if I don't come in for my regular routine care?
Right.
You know, what's going to happen to me? Periodontal disease is painless until your teeth actually are mobile and fall out.
Right.
A lot of times you're not feeling a thing.
Yeah.
So I feel we have an unbelievable opportunity right now. I don't know whether, I just wanted to share with the British Dental Journal, there was some amazing science that came out just recently. And it was a study that was all about those who had severe COVID symptoms and those that had lost their life to the disease. Now, these were people that had comorbidities, but think of our clinical practice. They had diabetes, they had hypertension, high blood pressure, elevated blood pressure, or obesity. Those were the three top comorbidities that were listed. Think of our dental patients that are sitting in our chair. Do we see anybody like that during the day?
Absolutely.
A ton.
Yeah.
Right? So what they went back to, and I found this so fascinating, is a bacterial superinfection. The very bacteria that were causing the severity of symptoms had their origin in the oral cavity. Periodontal pathogens.
Yeah.
And the second part, which is what I've dedicated my life to over the last several years, was the excessive inflammatory response related to a chronic inflammatory disease. Well, any of our listeners would say, hey, I know which one is the most common known to mankind. It's periodontal disease.
Yeah, absolutely.
And we're on the front lines.
Yeah.
So that's where I say, man, this is a great time to be practicing.
Yeah.
People are ready for the message.
100%. And to really, to listen to that message about how the overall health and periodontal health connect. And the other thing we were talking about, and sort of that you're touching on there too, is, and part of my feeling as well is, if you have a dental practice that has been in the fortunate situation of just been having a hygiene department and program that was just busy. And there might have been, it could be busy despite the fact that the patient education, the value building maybe wasn't there as well as it could be. And there will be some practices now that are, as we sort of mentioned in sort of the title of this discussion about refilling your dental hygiene schedule, they might say, some dental practices might discover, oh, it's harder for us to fill up our hygiene schedule the way it was. But now, like you said, that's the opportunity to really refine things and do things the right way, bring things up a level in terms of educating and building the value and explaining the link between inflammation and general health and that sort of thing.
Mm-hmm. And I think what we need to do is recognize that it's not all going to happen in the treatment room. That's a big part of it.
Mm-hmm.
But the whole messaging, you know, from that very first contact in the phone call, get rid of the word cleaning, you know,
Right.
and talk about what that appointment really is about. Sit down with your team and figure out, okay, I like to work in threes because that's where my mind actually can retain the information. Beyond that, forget it. 3 things at the grocery store, I don't need a list. When I go beyond 3, forget it. Got to make the list. But 3 top things. We're glad you have chosen our dental practice for what? We know you will be pleased with what? You know, what are the 3 top things that really make you as a standout in today's world?
Right.
And what are those 3 top messages that you want to convey? So there's the first opportunity and the contact with the business team member, but then there's also the website. Website is a great opportunity to disseminate information and to be able to put some really cool links and just some, you know, sound bites of why it is so important today. Chronic inflammation is a killer, and we need to really be focused on eliminating. So through our little discussion today, or through our discussion today, there's a couple of things that I want to bring to attention of your viewers.
Yeah.
This is probably one of the greatest gifts that I could give you, and I'm not going to take any credit for it at all. I'm going to give it all to my colleague, Dr. Tim Donnelly, but I love what he has online available to you. And if you Google this, it's the least important thing we did today was clean your teeth.
Yeah, I love that.
Dr. Tim Donnelly, Donley. So brilliant, so gutsy.
Yeah.
And it says it all, because how many times do we have that patient that, or client, I know I'm too old to say client, but how often do we have that patient that really says, you know, I'm not due for my cleaning, or my insurance doesn't cover this every 6 months. My teeth feel pretty good. They look in the mirror. They look okay.
Mm-hmm.
They're not feeling any pain, so they opt not to come in. So this is something that I would suggest you put on your website, you give to your client at the end of the appointment, help them understand that we helped you become inflammation-free.
Absolutely.
That's the critical message.
Yeah. And it's almost like, if you reframe it a little bit, like you said, it's sort of like the clean teeth is the result, is almost the byproduct of the period. So if you're focusing on the disease and the inflammation, the periodontal problems and the education that way, the end result of that is, yes, you end up with clean teeth, but like you said, that's not the health reason of what we're doing. Your teeth end up being cleaner because we clean them, but we're actually treating the inflammatory disease that's causing the problems. Yeah.
Exactly.
No, I love that. I remember, you mentioned that, and I've been thinking about that sheet since you'd mentioned it. So
yeah, it's a great one.
Yeah. And I should mention, so at the end of this interview and on this Facebook and social post and in our resources, we're going to be putting links to everything that we mention here. There'll be links to Joanne's resources as well as anything we mention along those lines too. So you don't have to make too close a notes as you're listening along here.
Exactly. And that's kind of my signature with any of my lectures or speaking engagements, is to make sure I don't just talk about a high level overview of science. It's more about how to. It's the knowledge translation piece and the tools that go with it. One of the other things too, James, that I found over the years of working as a dental hygienist, like think back when we went to school, I had like 10, 12, 14 hours to complete a client. And then you get into reality of clinical practice, like this is some cruel joke. I have like 9 people in my column today. How do I ever do that? You know, a medical history update takes 4 hours when we're in school.
Yeah.
So it's an impossibility. So one of the things, and one of the reasons that I named my company RDH Connection was the ability to be able to make that connection again, with the patient is so critical. So let's take like a medical history. If we say any changes in your health since the last time we saw you, if you've been hospitalized, any new medication, are listing their medication, we don't often uncover what is really critical. What about family history?
Right.
What about, have they been told they're pre-diabetic? Not a type 2.
Right.
It hasn't been diagnosed yet, but they're pre-diabetic. And we know that unless there's some significant changes that happen, they are going to go on to become full-blown diabetic, of which we know one of the strongest correlations with systemic health is with diabetes, with oral health and diabetes. So another resource that I made available that you can post is a medical history update that is done in the reception area. So it can be done electronically on a tablet, or it can be done a checklist with a hard copy, whatever way your practice is going to utilize it. But it asks a number of questions, and it only takes about two to 3 minutes for the patient to fill out.
Right.
But it enables, the dental hygienist goes out, brings the patient back, goes through this form, and it enables that connection. If they talk about more joint pain than they've had in the past, what a great opportunity to say collagen is is a byproduct of what's going on in that gum pocket where your infection is. Collagen is being broken down, not just in that pocket that now allows me to put that probe in there and go from a 3 millimeter to a 5. That's happening in every joint in your body.
Right.
So see where I'm going with that? We need to connect at that deeper level.
Right. And absolutely to kind of build that above and kind of work a little extra hard to dismiss that perception of the cleaning versus the overall health and the inflammatory process and how it relates.
Yes.
Can I ask you, just if we can think along specifics and real world in terms of today, tomorrow, and over the course of the next week. So let's say, okay, dental office is reopening, hygienists are starting to come back in, dentists are starting to come back in, hygiene coordinators, office managers coming in. We're looking and say, how do we get the schedule filled? And so inevitably there will be emails, there will be phone calls, there will be just like, let's start calling people, who's overdue, that sort of thing. What would be some nuggets in terms of communication, I guess, like you said, sort of sound bites or things to say in that first outreach that you feel might have the biggest impact to registering with the patient to say, yeah, you're right, I better come back in? Because there will be a sub-segment of patients who think, they said I'm supposed to come back every 3 months. I didn't, and nothing's hurting. And so there will be a little bit of breaking down that perception. But what are some things that from that, you're reaching out to your patients, you're in the office, let's get this hygiene schedule filled, let's get our hygiene department back up and running. What are some advice or nuggets or phrases or ways that you would kind of hit that initial connection to build the value?
Well, a couple of things. I think one of the things that we face too is related to dental benefits. So one of the things that I have always said strongly that we need to say with conviction is that I promise I would never ever base your dental needs, your overall health on the plan your employer has chosen for you.
Yes.
That's really critical to convey, because that has nothing to do with the required treatment. Absolutely. The other thing that I think is so important is to say that, let your patients know you're so thrilled to be back, you're thrilled to be providing services for them again, and you realize, as I'm sure they do, that keeping your body healthy has never been more important. And I really feel that we need to go further down that road of having a one-liner that says that the health of your mouth is so closely related to the health of your body, that chronic inflammation is at the top of the list today in order to keep the public safe and healthy.
Right.
And chronic inflammation, the most common area of chronic inflammation is in the mouth. And we as your dental home, as your dental practice, want to be sure that we stay on top of that for you.
Right.
We are doing everything in our power to do that, because that is what we know to be true in science today.
Mm-hmm.
So I think instead of calling up and saying, you're overdue now for your checkup and your cleaning,
Right.
to be able to say, talk about the wellness appointment. And never before has there been a time when our practice has been more engaged in making sure that we offer you the very best in keeping yourself healthy.
Yes. I like
You
that.
know,
Because, yeah. And you could even something along the lines of, oh, we couldn't wait to kind of get in touch with you because the more we hear about the
yes,
coronavirus and we know that
yes,
your dental health and your gum health is linked to overall health and we want to make sure you stay as healthy as possible. Right.
exactly,
Building in that link.
exactly. Now,
Yeah.
I also feel, and this is probably opening up another discussion, but I also feel there is going to be that segment of the population that may be hesitant to come in. When we look at all the different types of personalities
Mhm.
that are out there, there is the over analytical, the overly cautious type person who will probably feel that for whatever reason, their risk outweighs the benefit.
Right.
And that's what we really have to keep in mind when we're talking to our dental patients, is that mitigating risk and keeping them healthy
Mm-hmm.
is so important to them. And we have to feed into, and we're really good at this. When we get a patient on the phone or we're talking to somebody face to face, even better, we can read through their body language and their facial expressions what their real concerns are. We know when that barrier goes up and it's maybe money, it's financial. We
Right.
know when that barrier goes up and they don't understand, but they're afraid to ask a question.
Mm-hmm.
So when we're talking to those patients, someone that maybe asks some questions like, what have you done in your dental practice to ensure our safety? That person is reaching out. They need
Right.
to have all that information.
Yes.
And there may be a segment of our dental population, and this is a business model as well. When we talk about, I like to refer to it, I know what the buzzwords are today, but a virtual care model
Mm-hmm.
where we can look at actually staying connected and staying in touch with our patients through teledentistry.
Right.
You
Yeah.
know,
I wanted to
tele,
talk about that with you a little bit too, because I know you have some experience with that and kind of delving into it a little.
Yes, and I do work a lot in the U.S. as well. Most of my lecturing is south of the border, just because of sheer numbers and the
Mm-hmm.
number of conferences that are ongoing in the 52 states that we have access to. But telemedicine, telehealth has really advanced, and this was pre-COVID. This isn't just now.
Right.
And when I look at it, and I was an advocate for it prior to the COVID pandemic, because I looked at the business model of it. There is a segment of our population, whether they are geographically opposed to
Mm-hmm.
not being able to have care, socioeconomic restrictions, whatever it may be, fear, hesitancy, anxiety, whatever the
Right.
reason may be, we're losing out to a good number of people that are not coming in and sitting in our dental chair. So
Absolutely.
pre-COVID, during, post-COVID, I feel like this is the tangible model that has such strong merit in our dental
Absolutely. Well,
practices.
just that whole concept of access to care, just like you said,
Mhm.
socioeconomic, geographic, or mobility
Exactly.
issues, things like that.
Yes, exactly. Caregiver issues where they don't have the ability of a caregiver, long-term care facilities to be able to have a photo or have a video conference. So
Mm-hmm.
teledentistry really encompasses, if you look at the in our province in Ontario, if you look at the RCDSO guidelines, talks about two different types of conferencing or two different types of teledentistry that are allowed. And one is more a consultation, which is a dialogue, and the other is through video conferencing.
Mm-hmm.
Video conferencing is great. However, when we're trying to look inside the oral cavity, and you and I know, James, as dental professionals, that sometimes we can look and within 10 seconds, we know
Right.
what that is.
Yeah. Yeah.
And we're able to allay their fears. So what I'm sharing, I'm not sharing product specific, but
Mm-hmm.
I want to give your viewers an opportunity to see what some of the options are out there.
Sure.
So the foundational concept. So this one is called Telescope.
Yes.
And this is my iPhone.
I
This
should
has
join.
a
I don't mean to
camera.
interrupt. I'm just going to say for the record,
Yes.
none of this is sponsored. This is strictly
No,
just for information.
no,
It's something that Joanne's sort of getting into. So she just wants to show the
exactly.
options that are out there. Absolutely.
Exactly. And I do work as an advisor with the company. So I'm showing you this, but I always like to reveal that with a professional audience. That's my responsibility.
Mm-hmm.
But I am not promoting the product. I'm talking about the concept of teledentistry. So anyway, this is an opportunity where this fits into, let me just slide this in. So this is the telescope. So what
Okay.
actually happened, and I do want to talk a little bit about oral cancer. So please bring me back to that.
Yes.
This was a campaign called Check Your Mouth. I'm going to come back to that because that's all part of refilling our hygiene shares that we did. I work as an advisor with the Oral Cancer Foundation, which is a North American outreach for patients, for survivors, for professionals, all about all things related to supporting oral cancer
Mm-hmm.
itself and education and so forth. But anyway, the Check Your Mouth campaign was an illuminated tongue depressor. So this fits on the back. So let me
Right.
just put that in. So this is illuminated. Now I'm going to offer myself up for science here. So no judgment.
Right.
Please, no judgment. So I'm
Percation
going to go to the
involvement on the
telescope.
2.6.
No, no, no. I'm going to go to the telescope app so you can clearly see
Okay.
how that has illuminated. I obviously would not have the layer of lip gloss on that I
Right,
do right
right.
now. But if I was going to take a picture, so forget infection control for a moment here, but
Right. Yeah. And
so
it's
I know it's hard to see
only as
because
a function of Zoom, and I'm sure just the Facebook to Zoom to that to your phone. But yeah,
it's
I
going
can
to
see how
be
that would be nice to get up.
challenging.
Yeah.
But anyway, what you can do then is, and I don't know whether we'll be able to actually access this, but I do have a link. I believe I gave it to you. Yes, I did, for a feature article that was in Oral Health called
Hmm.
Socially Distanced Dentistry.
Right. Okay.
So here's one of the pictures that I took, but again, you probably will not be able to see that fully.
Yeah.
But what I wanted to say is you can annotate that. You can put the symptoms on if it's sensitive to cold or whatever. There's recession. There's
Hmm.
actually a little measurement tool. And then you hit the arrow and you send it off as an email to the dental practice that you want to have your
Right.
consultation call with. So that enables a very high resolution intraoral picture
Hmm.
that a dental professional would be able to look at and say, yeah, I get that. This is what the problem is, and be able to have a very intelligent conversation with the patient. And I'll tell you how this evolved, or not how this evolved, but I'll tell you why I wrote the article. My husband, and this is actually in the article, had a phone call from his dermatologist. And they said, we're sorry, we're unable to see you right now. However, if you have any areas of concern, could you take a picture or get your partner to take a picture and email them to us?
Right.
So no, there wasn't any encryption conversation, any PIPA, PIPEDA,
Right.
no conversation around that at all.
Hmm.
My veterinarian did the same thing. They will do a virtual call as
Yeah.
well with a
Yeah.
consultation. But anyway, so my husband sent the photos off. The dermatologist was able to look at them and then have a phone call with him the next day, a video conference call on Zoom,
Hmm.
and be able to say to him, I have no concerns over any of those
Right.
areas. They're all absolutely fine.
Okay.
And we'll see you again. And they booked something for a couple of months ahead when they were post pandemic or felt that they could open their doors again.
Yeah. Yeah.
So, it just, to me, it's so common sense. It's ridiculously sensible to be able to have this kind of rapport and connection with our dental patients.
I'm trying to kind of picture just the logistics of what you had just shown us. So so if a patient's at home, they've got that can so would a dentist mail that out to how would a patient get, if they're doing it from home or from their own accord, is it a fairly inexpensive piece that patients who have sort of access difficulties, they might just spend a bit of money to have one on their own to be able to do those types of consultations? Like,
Yes,
how does it actually what are the logistics
yes.
of that?
So let me talk about a couple of different products. So teledentistry, there have been capabilities for not a high end, but a more minimally priced intraoral camera to be
Okay.
provided to patients. So I have heard of that as well. And the name eludes me at this moment, but if you do some Google searching on teledentistry, a lot of this information will come up.
Yeah.
The throat scope, which I showed you here,
Mm-hmm.
this is something that we had with the Check Your Mouth campaign.
Okay.
So our hope was that patients would check their mouth regularly, so with an illuminated tongue depressor, look inside their mouth and be able to identify anything new or abnormal that
Right.
wasn't there last month. And the key was it persisted more than 14 days.
Right.
And be able to book an appointment with the dental practice rather than, as we know, oral cancer a lot of times is free of symptom.
Absolutely.
Bring me back to oral cancer. We need to talk about that in a moment too. So bring me back there at one point. But with the Check Your Mouth campaign, that was the idea. So that can be ordered off checkyourmouth.org.
Got it. Okay.
From the Oral Cancer Foundation. You know, you can go online to Throat Scope. You can find that. To my knowledge, it's one of the only tools that is out there that has an accompanying app. The app is available in the App Store. Telscope, Telscope.
Yeah.
And there, I saw, and again in oral health, I think there was an ad in that alongside with that article on socially distanced dentistry, talked about another type of app as well. So you do the work yourself. I like the Telscope one because it has the ability to annotate and measure and everything else. So it has some other parameters to it.
Yeah.
So how it would work is the patient, really, my feeling is to check your mouth or check your child's mouth with an illuminated tongue depressor for a purchase price of about $30 makes perfect sense.
Right.
So if they have that at home and they have the Telscope app, then they would just put the this on the back of the phone and be able to send the picture off to the dental
Got
office.
it. Yeah.
So that's how that works. Now in the US, I know that the company is working with a number of different providers to make this the device that will be the delivery mechanism for the teledentistry capability.
Yeah.
So that's how that works. So we're a
Right.
little bit premature in Canada at this point in time, but it is coming and should be here by about the next, I would say 30 to 60 days. But again, I don't know anything about production there. The other thing around this too, James, is from the business model. I know through talking with other provinces that there are codes that are being put in place to recognize the professional time that is going to be dedicated to a consultation.
Right.
So whether it's an in-person or whether it is teledentistry, it is a chargeable service.
Yeah.
And something that can fit inside, you know, the business model of the practice. And I think of all those units that kind of sit there that are sort of dangling 10 minutes here, 10 minutes there for the business team to be able to schedule that patient into.
Right. Well, and that's kind of what we talk about too, because everybody wants to be helpful to their patients. And certainly in my discussions with friends and colleagues, and even the Royal College saying, hey, you should try to do teledentistry if you can to avoid an in-person visit, just to minimize spread, that sort of thing. And most of the dentists I know for these consultations, they're just doing them. They're not billing because they want to be helpful during a difficult time and all of these. If someone's going to actually implement this into the practice, realistically, and as you said, it seems as though provinces are introducing codes for this type of thing. And if a practice does want to integrate this type of consultation into their practice, it probably will be a medium and possibly long-term solution for this type of thing. But at the same time, offices do want to know from a business standpoint that they'll be compensated for the time as well. Because in the short term, during a pandemic, everyone's pitching in. But if it ends up being part of a dental practice, scheduling this in and allocating time and the team to it, then it would need to work into the business model as well.
Exactly. And talking with a few of my colleagues that are really immersed in this in the US, they're saying that the backlog in hospitals too is going to be incredible. And we don't want to be filling up emergency treatment rooms with dental concerns.
Right.
That could, not always easily, I'm not trying to purport that everything is going to be readily accessible for a comprehensive assessment, but there are many different cases that will cause pain. May need a prescription, may be obvious infection or draining fistula, whatever it may be, that there's a short-term remedy that we don't have to place that person at risk in an emergency treatment room in a hospital setting or, take up the time of our frontline workers as well.
That's
So I think there is a number of things there that really apply.
even a good friend of mine. She works at a public health clinic, and she
Yeah.
just this past week, she said on a daily basis they have an emergency appointment that is essentially a loose primary tooth, and so which is it's not. I mean, it's a little inconvenient, but during a pandemic where you're trying to minimize these in-person visits as much as possible, but also taking up the chair time to say, oh no, don't worry, it's just a loose primary tooth. The teledentistry
Exactly.
option would be a nice opportunity for that as well, just to kind of minimize those things and say, don't worry, everything's fine. You don't need to come in. You don't need to take a day off work to bring your child or that sort of thing, person in
And
for.
how many times have we had a parent panic and say, my child's growing 2 rows of teeth?
Right,
You know,
right.
and,
Yeah,
and that you know, the 3-1 and 4-1 are erupting, and all of a sudden they think they've got a second set of teeth that are coming in behind, and they're
right.
very upset about that, and understandably so.
Yeah,
Or that person that has an abfraction area or an aphthous ulcer, anything like that.
yeah,
That these
yeah.
are so simple for us as a dental professional to be able to look and say, hi, I know what your issue is, but let's maybe circle back in 14 days, make sure that's resolved, or
Right.
whatever it may be. So I
Yeah.
really feel strongly that there is a place for this in dentistry
Mm-hmm.
from so many different standpoints. It's a win-win for the patient, for the dental team, and for the practice itself.
Yeah,
Definitely,
absolutely. Yeah.
definitely.
I think so too. And even as you and I were talking about, there's a bit of friction. There's some not friction, but there's steps that need to be taken and measures that need to be taken to set up this teledentistry thing. And as you and I were
Mhm.
saying, the likelihood that it'll be not just short term to say, oh, I went through all of this work and we're only using teledentistry for 4 weeks, but that there's potential to have this incorporated into your practice and your care for your patients in the long term could make it worth investing in the infrastructure needed to be able to provide that.
Exactly,
Mm-hmm.
exactly. And I think, anytime we put thought into something like this, we need to look at it as a long-term measure. And we also need to look at the cultural norms that exist right now.
Mm-hmm.
And this type of virtual care is getting so much more commonplace, with physiotherapists, with like right across the regulated
Yeah,
healthcare
yeah,
network. It's where it's at and what people are expecting at this point in time. So
yeah.
I don't see it as a short-term solution at
Right.
all.
No,
I see it
I
coming of age and kind of catapulted a lot faster than its debut was about to happen.
right.
But I don't see it as a short-term plan
I don't think so
at
either,
all.
and especially heaven forbid, but in the uncertainty of either some sort of second wave or us having to manage these situations again. Hopefully not in the future, but there's always that chance, and there's talk of
Hmm.
that too. And there's a lot of dental practices that would have an overflow room to say, oh, don't just bring them in and I'll do a quick look. But in a time where we are trying to minimize those sort of times where we don't necessarily need to use that extra PPE and the in-office visits and all of the extra precautions to have someone come in and say nothing to worry about. I think even from a public health safety standpoint, the teledentistry is a good idea that way.
Yes, exactly, exactly. And you may have them in that treatment room that doesn't warrant all of the other precautionary measures, as you say, or it may be that virtual call. There's
Mm-hmm.
different ways that teledentistry doesn't mean that they do have to be just on that video call. To be able to have that capability to see intraorally allows you that opportunity to be able to really assess them much more
Yeah,
proficiently.
right.
Yeah, totally
Yeah.
believe that.
Now, only because so do you want to loop back to the oral cancer part and touch on
Yes,
that a bit?
I do, because again, going back to that message of this is the best time to be practicing. For years and years, we had historic etiologic pathways of being smoking and alcohol,
Mm,
which left a certain segment of our population say, hey, I'm not at risk. I don't smoke. I don't consume a large amount of alcohol. I'm really not at risk for oral cancer screening. So that part of the checkup was
mm-hmm.
not really a critical part. And now when we look at that, the fastest growing segment of the oral and predominantly the oral pharyngeal cancer profile is related to a virus. It's
Right.
related to HPV.
Yes.
And so a lot of my time, my research has been spent on this over the last probably 10 years at this point or longer, talking about this and how important this message is to articulate this to our dental clients, and how important it is to understand what the subtle symptoms are, because it's an area where we have impeded visual acuity, because it's a posterior placement. It's everything back behind the sulcus terminalis, or that V-shaped trough on the dorsum of the tongue. It's everything back there that a lot of it we can't see.
Yeah.
But when I go to websites, I don't see this information being there. And it's not to be a fear monger, but our patients need to understand that just because they aren't a heavy smoker or consume a lot of alcohol, that they're not at risk for oral cancer.
Absolutely.
That's not true.
Right.
So our messaging, again, our website can really do a lot to refill our chairs. And these are some of the messages that I don't see out there when I'm checking and looking at dental practice websites today, that really need to be front and center. You know, this is much more than a checkup and cleaning. So I have an article that I wrote a number of years ago, and, you know, it's kind of along the standpoint or the same lines as Dr. Donnelly. The least important thing we did today was clean your teeth. But my article was called "Just a Cleaning? Think again." You know, and that's so true. We need to get this message out that when, you know, and that's something I would put on my website today. Your dental hygiene appointment consists of this, 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 and this. And this is why those 3 pieces or 4 pieces of the treatment plan are so critical today beyond measure.
Right.
With keeping you healthy, keeping you risk-free. You know, and a lot of times we can preface change in the way we practice our treatment protocols by saying, "We now know." I always like those three words, "We now know." No judgment. You know, "Hey, why didn't you do this before? Or why didn't somebody tell me this before?" We now know.
Right. And that's a really good point, because there's integrity and the idea of raising public awareness about something without being fear-mongering and without trying to trigger fear to fill your schedule for the sake of filling your schedule. But they go hand in hand, raising the public awareness of this and getting people in for screenings and to be checked in conjunction with their recalls. Absolutely. There's health integrity in that.
Yeah, exactly. So one of the links actually that you're providing with this, it's called 30 Days, 30 Resources, and it's off my website. I don't have a newsletter. I don't consult with it. I don't send out any emails. I don't keep emails. I just answer people for what they want. And I always say I'm getting way too old, chronologically enriched, to dare keep anything to myself at this point. I'm here as a resource. I do a lot of research, and I'm here to help. So on my website, the link will be there for them. If you go to articles, there's something called 30 Days, 30 Resources. And for the month of April being Oral Cancer Awareness Month, I put a different resource out every single day.
Okay.
So if anybody wants to go to Facebook, I also put them on LinkedIn. I put them, Instagram's a little bit more challenging just because of format, but LinkedIn or my Facebook page has 30 different resources for oral cancer. So everything that you need, like free downloads, how to document, what to call a lesion, you know, some of that descriptive terminology, we don't see it every day. So we forget, you know, what's pedunculated, what's exophytic, you know, some of those words that we don't have to use, they're not in our day-to-day language.
Right. Yes.
So happy to share that.
Okay.
For sure.
Ashley's in our background here, and she's just checking for questions and things like that. One of them we sort of touched on was just about in terms of how to help allay the fears of patients, and I think we touched on that really nicely. I think I would just add maybe in that when you were saying about these are the steps our office has taken, whether or not it's a verbalized question about what has your office done, I think there's probably value in just always explaining that to whoever you're reaching out to, right? So they might not ask it. You might say, "Hey, you should come in for your appointment." And they say, "Okay, sounds good." In their head, they're asking. And some will say and some won't. But even for those that don't ask, there's probably value in conveying that regardless of whether or not they ask. You could say, "Just so you know, this is what we've done. We're following the guidelines. We've got these steps in place. It's going to look a little different when you come in, but don't worry, that sort of thing."
Great point. And that is part of what we touched on earlier with we're delighted that you've chosen us as your dental home, or thank you very much for your phone call. This is what we have done. So the 1, 2, 3 saying, and having that a scripted response that doesn't have to sound scripted, but these are the 3 main things that we've done. Make it easy on the team to be able to recall that. And also on the on hold messaging. You know, I would have that in my on hold messaging for sure.
Good point.
I would have that as well as close the link. Also include why it is so important to have a healthy mouth in today's world, because poor oral health is related to COVID severity.
Yeah.
I would even go so far, because there are going to be patients that will want to read that. Look up the article by the British Dental Journal and have a link on your website.
Right.
You know, and close that link, tell the story.
Right.
This is what we've done for you, and this is why your care is so important to you right now and to us, and we're pleased that we're able to be back. We could hardly wait to get back, because this is of critical importance today.
Yes. And even I would add, so the on hold is brilliant, and maybe not as long, but some excerpt of that on the voicemail outgoing message, when if patients are calling and your office is closed, a little word of reassurance, a little word of we're really looking forward to seeing you again, and these are the steps we've taken, that sort of thing. Yeah, I think so.
Exactly. Any opportunity to get that message out. But instead of so much focus, the only thing I'm suggesting, instead of so much focus, you know, my husband and I had this conversation the other night, and he always plays devil's advocate because his company is in brokerage of heavy equipment. So as you can see, there's not really a lot of parallels between our 2 businesses, but we still manage to have very lively discussions. Yeah. And I love his perception, because he's Joe Q Public, and he's going to give me that challenge as to, okay, why is this important for me? And he said, and you know, we got talking about it, and he said, well, I do want to know everything that people have done in their dental practices to keep me safe. I want to know that social distancing is in place. I want to know that PPE, you know, what they are doing to prevent that, or more to keep containment of aerosols, and how they are preparing a room and that sort of thing. And so we could use this all as messaging, and then we could have a printout that was available, and also something backed up on our website that goes into more detail of actually what we are doing in, you know, a more comprehensive list. But I said or he mentioned at that point, he said, but you know, it needs to really close the link too. Okay, so that's what you're doing. So I don't have any problems with my mouth right now. Why do I need to come in? Right. You know, and I always love those conversations, because as straightforward and simple as it may seem, it's one thing that is really overlooked in our dedication and commitment to the public of really trying to make sure that they understand that we have their safety in mind. But let's go one step further and say their safety and their health, oral and overall, and finish that story. Yes.
And I think any improvements or refinements or any way that a dental practice is going to optimize their communication, their connection, their value building, their recall systems, the messaging, that is not a temporary situation thing. All of those improvements, all of the efforts that an office might make to refill their schedule and reconnect with patients are things that it's not as though it's a wasted effort. Now you have a new system in place that's even better than the one that you had before the coronavirus, and that'll carry forward in helping keep the hygiene schedule full.
Exactly. Yeah. Exactly. And you know what, James, we're not a stranger to this. When I look back over the years of practicing, I went through the HIV/AIDS era, and SARS and MERS, and you know, some of the other things, and our universal precautions that we've had, that we have adhered to, honest to goodness, we need to give ourselves a pat on the back. I would say, I would dare to venture to say that as a regulated healthcare profession, dentistry and dental hygiene have done more in this area. I guess I better be careful, but I really feel that we have made an amazing effort. Right. I want to share one more article while I'm thinking about it. I was reviewing this earlier today, and it's back to work treatment recommendations. I did put it on my Facebook page, so it is available there, and there is a link. And just remember that my mother gave me everything. She gave me the the hyphen, the capital A, and the E. So it's
Nice.
Joe hyphen and Jones.
Right.
So Joanne is hyphenated if anybody's looking for it. But on my Facebook page, you'll see this article, Back to Work Treatment Recommendations, Aerosol Containment, Dental Hygiene Procedures, and Personal Safety Practices. And I want to preface it by saying that, first of all, for myself, I am not an expert in that area. That's why I have not talked at length about air changes per hour and PPEs and all the enhanced infection control measures. But secondly, and I did want to make this point as well, this article is not a guideline. It is science and research amalgamated together with reasoning. So if we look at that, our whole profession is based on that evidence-based decision-making model. So it's our clinical judgment, it's our patient preferences, it's our clinical preferences or setup, or the structural framework that we work within, and it's scientific literature. And that's the only thing I can say about this, is that, at this time of somewhat a lack of congruency and some disparity, that evidence-based decision-making model does have 4 facets. And I really feel confident that we can look forward to some type of mutual consensus that will take in these 4 facets. So this article is only one facet of it, but it's really a worthwhile read.
Nice.
And you'll be able to download the full, the link has the full article. And that is written again by my colleague, Dr. Tim Donnelly.
Okay.
Danny Botbill, who is an ultrasound expert and just on yeoman's duty through this pandemic to help support the dental industry in understanding the containment of aerosols.
Right.
And Beth Ryersey, who is also a very well-respected dental hygienist within the Canadian framework of the profession of dental hygiene. So it's really something worthwhile to read.
Nice.
Because it gives us that more rounded approach to understanding what the eventual guidelines will be for our profession.
Nice. I'm really glad you mentioned that, because so that was the question number 2 was, just can you comment on the RC, sort of the dental college and the hygiene college guidelines? It's a very active and hot topic right now, of course. It's a constantly moving target because new research is coming in, new guidelines, new recommendations. And I'm glad you mentioned that, because it is an opportunity to sort of, there's a lot of people picking sides, and sort of there's some feelings that have been developing about that, and I don't mind talking about it too. I didn't want to necessarily put that on you as a question because I didn't want to impose that, but if you don't, I'll just spend 30 seconds talking about it too, because I think even just us talking about it, I don't think we're so in the profession, we shouldn't shy away from it. And my perspective is very similar to yours in that, because the research is a moving target and each college is doing its best to come up with guidelines that protect its members and the public. Now, it seemed as though earlier this week, the dental college came out with theirs that was newer than the hygiene college. I know they're in talks and communication. I'm confident there's something that's going to be worked out. But even as new research comes in, as PPE gets more available, dentists and hygienists and assistants, of course, too, have been working together so well. And I know everyone's stressed out and everyone's worried about going back to work and what is it going to look like and are we going to be safe? But I just hope that this time, and as things are sort of reconfiguring for what this first phase of the new normal looks like, that we don't forget that we're all dental professionals working together, and don't throw aside all of this collaboration and dedication to the patient care and the public health and the public safety that we've all just dedicated ourselves to.
And how far we've come
exactly
over the years. Yes. And as a unit, we function so well in the service of the public. And it goes back to, I'm sure you're feeling the same way with the family, James. We are all struggling right now with how to even go about our day-to-day activities.
Yeah.
How many people, who can we get together with? Who can we see? Who can we have over? Can we, all of these things are so fluid right now. And it's so frustrating, and it's not a time for criticism. It's not a time for judgment. it's a time to really kind of say, okay, I'm going to keep a cool head and I'm going to give people some slack right now to try to figure this out because
Yeah.
it is evolving every day.
Yeah.
And I'm not stepping back from it because I'm a coward. I'm stepping back from it in respect of those that have a lot more extensive knowledge than I have.
Mm-hmm.
And I could be the one person that would convey a message that would incite my profession or the dental profession and put a lack of unity and
Mm-hmm.
dissension there that really doesn't need to exist because it's evolving in its information.
Exactly.
And I think we need to breathe and need to keep a close eye on this.
Mm-hmm.
And we need to feel comfortable. You know, we just had this conversation with our family that,
Yeah.
you know, we're seniors in our family and these are the things that we feel comfortable with. It might
Mm-hmm.
not be what the rest of, you know, our younger sons or daughters, whatever, are feeling, but this is where we're at. So I
Absolutely.
think we just all need to really be kind and just take a breath and let it play out. You know, give it 24 hours, give it 48 hours, let the regulatory colleges who are both there in protection of the public to be able to, you know, and have the safety for us as providers to be able to come up with the best possible guidelines. And I am confident that there will be a consensus that we can all live with.
Mm-hmm. I'm 100% confident in that too. And I would just add one of the things I certainly don't shy away from discussions and opinions in any way, but one of the things I find challenging right now in terms of my only strong opinion is that we don't divide and that we work together on this. To have a strong opinion on one side or the other is not something, because everything is changing daily. So if you say, oh, I formed this really strong opinion thing, tomorrow guidelines could be different, science could be different, research could be different, situations could be different. So to form a strong opinion other than let's figure this out and work together, that to me that's something to grasp onto. At the same time, and like you said about breathing and speaking with your family, is that there's people who are genuinely fearful and worried about not only their health, their family's health, but their livelihood and the patient care and
Of
all of those sort of
course.
things. People aren't always at their most relaxed and best selves during times of stress and things like that. So like you said, take some time to breathe, take some time to listen, take some time to take 24 hours and rethink things and that sort of thing. But at the same time, I think colleges do listen to their members. So it's not to say, hey, everyone, just be quiet and let your colleges do it. The colleges need to hear the voices.
Mm-hmm.
But hopefully they hear calm, thoughtful, collaborative voices to work together.
Mm-hmm. And this is why I really like this article so much, because it gave us the science behind aerosol production, which are an aerosol containment.
Right.
And this is and the authors state in it that this was by no means meant as a guideline, but it's something to assist the regulatory colleges in
Right.
understanding.
Yes.
So I found it very useful. It's not going to be a standalone document, but I just found it very, very useful and thought-provoking and compelling.
Right. And I think the more different perspectives that we can see from everybody who's interested and everyone who's involved, and the more we can see the different perspectives and the different sides, and kind of, I think that's a real key to everybody working together on kind of just aligning what we're doing.
Exactly.
Yeah.
Exactly.
So Joanna, I'm not in a rush to go, but we're getting near the hour mark. Is there anything else that we haven't touched on, that a message you want to get out? Anything else you want to say? Anything else you want to talk about what you've got coming up in terms of on your schedule that you want to let people know about?
Well, a few things. Again, there are some links. We had a very lively online or a webinar, actually a live and then recorded, called Giving Our Clients Our Best in a Post-COVID World. So if any of your listeners is really interested in learning more about treating the inflammatory component of periodontal disease and ensuring that the practice is following the current guidelines, I would really suggest that that's a good watch. Something that should be incorporated as part of our model of treating periodontal disease today.
Mm-hmm.
So that's really, probably that's one of the most important things
Okay,
as far
nice.
as the links I've provided.
Yep.
And out of all the meetings, I've still got Greater New York on my
Great.
timetable. So I'm fingers crossed. I love New York and hoping to go there in November. But the
Oh, nice.
ODHA, the Ontario Dental Hygienists Association, my lecture is going to be live streamed.
Okay.
And it's talking about the primary care provider, the dental hygienist, the primary care provider,
Mm-hmm.
and what our role is. A little bit about what we've talked about today, but much more in depth about our clinical role, especially in today's world.
Mm-hmm.
So I will be live streamed on the Friday of the conference, and so that has
What's the
gone
date of that?
virtual.
What's the date of that one?
It is,
Not to
I
put
knew
you on the
you
spot.
were going to
It's
ask me
Friday.
that.
It's hard to even
I
know what
will
day
find
today is.
it. Yeah, what day is it? Are we Saturday? I don't usually work on a Saturday, so I know it's not Saturday. It'll be live streamed on September 25th.
Okay.
And my colleague, who is well known to your audience, Kathleen Bacrossi,
Of
is
course.
going to be live streamed on the Thursday, the day before.
Ah, neat. Nice.
And this year they've got a wonderful, generous offering to all who register. Will be able to view all sessions.
Okay,
So
amazing.
that's quite a registration package when you look at it. A lot of value
Okay, great.
for the registration dollar. So I'm doing that, and then ADHA. I'm live streamed for that as well, the American Dental Hygiene Association.
Right.
And that is coming up June 26th, and I'm live
Okay.
streaming 9 to 10 a.m.
Nice.
And a little bit more again on inflammation and how important that is. That's a key topic for me, and oral cancer as well. And then I've done about 6 webinars with RDHU
Oh, yeah.
over the
Okay.
last few weeks. So
Right.
those are all available on the RDHU website as well.
Perfect.
Yeah.
Amazing. Well, thanks very much
busy.
for joining me with this talk. I've come away from this just really kind of inspired, and also with a great perspective, and also a real feeling of, just like we had talked about, that we can turn this into the way to refine what we're doing, optimize what we're doing, and really come out of it stronger and better than when we went into it. So.
Mm-hmm. Very good. Yes, and the pleasure has been all mine. I've thoroughly enjoyed it. And it is an opportunity to be able to encourage our colleagues, and, we will get through this together, and we'll be stronger for it.
Absolutely. Okay. Well, take care, Joanne.
Great.
Thank you very much. Okay.
Okay. Thanks
All right,
very
bye.
much, James.
Okay.
Bye-bye.
All right. Bye, everyone.